In Fox 5 Health News, chronic loneliness may be the biggest public health threat Americans face. Researchers say it has more of an impact than even obesity.
All right, joining us now, Fox 5 medical contributor Dr. Devi Nampiaparampil. Depressing but real. The mind-body connection is so real, you know?
It's true. I mean, we think about all these other illnesses, right? Heart disease, high cholesterol, high blood pressure. But in fact, you know, we've underestimated the effect of loneliness. Now, we're talking about loneliness, not necessarily a mental health diagnosis like depression or anxiety.
Sure.
But these researchers basically looked at 3 different factors. So this subjective feeling of loneliness, so if you feel lonely, social isolation, so where you might not have that, but you feel like you're removed from a community and from other people, and then also whether you're living alone. And then those 3 factors seem to affect your health more than these other medical conditions that we traditionally think about. So I'm not criticizing people. I mean, I like my quiet time. I'm an introvert,
Hey,
you know.
We're only children.
Reach, doctor.
So it's not for people who like to be alone or want periods where they're alone, but it's more this feeling like if you feel lonely, so you may see a lot of people and still feel lonely, right? You may be in the middle of New York City or Manhattan and feel
People
like...
always talk about it. It's actually isolating being here. You feel alone around, you know, 10 million people.
Or we're so connected through social media and all these other things, yet not in real ways, so you feel alone.
Exactly, and not to diss social media either, because some people may feel like that's very interactive for them, whereas others feel like that isolates them more. But I guess the purpose is, you know, if you feel isolated, that you should take that seriously and talk to the doctor about it too. And then in general, as a community, whether it's in the medical system or otherwise, we need to kind of reach out to people and find out more about those things. I think part of it is also if you have a community and support, you might feel like addressing your other medical problems, whereas otherwise you may not really either have the will or the knowledge sometimes to be able to do it.
It matters a lot, no, for sure. That's good info. All right, how about this? Can supplements help your thinning hair and nails? Consumer Reports takes a look at the claims of these products and finds that pills don't really make much of a difference. We've done this on basically every pill-based claim when it comes to supplements. That is like, it doesn't really do anything.
And I still take those like hair vitamins and nail vitamins, whatever they say.
It doesn't work out.
It doesn't seem to work. So now, you know, you can have products that can make your hair look better, for example, or your nails, right? So in terms of the appearance of it or how it feels, I mean, even in toothpaste, you have chemicals that keep it soft in the tube for years, right? So in the same way, your hair can look or feel better. But if we're talking about the health of the hair, the health of the nails, that's a different story. Now, sometimes people can have these changes in their hair and nails just related to medical issues. So sometimes people can have low thyroid hormone. You know, some other medical problems can also affect these things. These are manifestations, so you may want to get it checked out. But if it's just related to sort of aging and these kind of natural processes, then those oral supplements don't seem to make a difference.
Those vitamins that I just bought to make my hair healthy were a waste of money. It makes you feel
your hair is beautiful, though.
You're very kind.
Maybe not from the supplements, maybe for other reasons.
It's amazing how you hear that over and over again, yet we still tend to fall for those things.
You're paying for the feeling you did something about something.
Yeah,
totally.
That's true.
I'm a total sucker for it.
All right, fair enough. Good deal, Dr. Devi.
Thanks, Dr. Devi.